Hey everyone, and welcome. Today we're diving into something that affects so many cancer patients, but often flies under the radar: anemia. It's way more than just a side effect, and as we're about to see, the way we're tackling it is going through a massive, quiet revolution, turning a huge hurdle into a much more manageable part of the journey.
Anyone who's been close to cancer treatment knows that fatigue is part of the deal. But what about that bone-deep exhaustion, the kind that no amount of sleep seems to fix? Well, that could be a sign of something more, something we can actually get ahead of.
So before we can even get into the really cool new solutions, we first have to understand the problem from the inside out. What exactly is anemia, and why does it pop up so often when someone is fighting cancer?
At its core, anemia is really just an oxygen delivery problem. Think about it like this. Your red blood cells are like a fleet of delivery trucks, and their job is to carry oxygen to every single cell in your body. But when you don't have enough of those trucks on the road, well, everything slows way, way down. And that's what causes that deep fatigue, the dizziness, even feeling short of breath.
And what's really interesting here is that in cancer, anemia isn't caused by just one thing. It's kind of like a triple threat. First, the cancer itself can cause problems, like bleeding or even blocking the bone marrow. Second, treatments like chemotherapy can damage that bone marrow, which is basically our body's blood-making factory. And third, and this is a big one, the inflammation that often comes with cancer can actually lock away the iron your body needs to build those new red blood cells in the first place.
Okay, so with all these complex causes, how did medicine traditionally deal with it? Well, for a long, long time, the approach was surprisingly one size fits all. It was a standard playbook that often didn't ask why a specific patient was anemic.
The classic tools in the toolbox were pretty straightforward. You had blood transfusions, which are really just a temporary top-up. Then you had oral iron pills. But remember that inflammation we just talked about? A lot of the time, that inflammation stops the body from even absorbing the iron from the pills. And finally, you have these drugs called ESAs, which basically just shout at the bone marrow to work harder. Now, these can all be useful, but they're all reactive. They're not proactive.
This quote just nails it perfectly. The old way of thinking was to wait until the problem got bad and then apply a standard fix, without really knowing the specific reason it was happening. And right there, that's the crack in the foundation where this huge shift in thinking began.
Which brings us to today, and a whole new era of care. Instead of that one-size-fits-all model, we now have the tools for a much, much smarter and more personalized strategy. This is really the heart of what we call precision oncology.
So what does that actually mean? Well, precision oncology is basically detective work. It's all about finding these specific biological clues or biomarkers that tell us exactly what's going on inside your body. It's the difference between a general weather forecast for the whole state versus a real-time satellite map of your own neighborhood.
And these are the game-changing clues right here. We can now measure things like hepcidin. Think of it as the lock on your body's iron stores. If that lock is engaged, oral iron pills just aren't going to work. We can also look at something called STFR to see if the bone marrow is truly starving for iron. And genetic profiling gives us even more information. These clues let doctors find the right key for the right lock for each individual person.
And when you put them side by side like this, the difference is just crystal clear. Standard care is reactive. It kicks in only when blood counts are already really low. Precision care is proactive. It uses those biomarkers to predict and even prevent severe anemia from ever happening. And just look at how the goal itself changes. It's no longer just about avoiding a transfusion. It's about maximizing a patient's energy and strength all the way through their treatment.
Okay, so this all sounds great in theory, but what does it actually mean for a patient going through this? Why does getting ahead of anemia with this kind of precision matter so much? Let's talk about the real-world impact.
The best way to picture it is like building the foundation of a house. Managing anemia isn't just about feeling less tired, as important as that is. It's the solid base that everything else is built on top of, from your day-to-day quality of life all the way up to how effective the cancer treatment itself can be.
So here's how it works. First, by keeping your blood count stable, you're way less likely to need treatment delays or have your chemo dose reduced. And staying on schedule is absolutely critical. Second, treatments like radiation and some chemos work much better when tumors are well oxygenated. And guess what delivers that oxygen? Healthy red blood cells. And of course, the improved quality of life is just a massive, massive benefit in itself.
But this is the most powerful takeaway of all. This isn't just about comfort. It's not just about quality of life. For certain types of cancers,
Studies have actually shown that patients whose anemia is managed proactively have a measurable 5-year survival advantage over patients with chronic, untreated anemia. I mean, just let that sink in for a second. We're talking about giving the cancer treatment the absolute best chance to succeed. This isn't just about feeling better, it's about living longer.
So all of this leads to a pretty important question. This shift towards proactive, personalized care is a total game changer. And if you or someone you love is dealing with that crushing cancer-related fatigue, it is absolutely a conversation worth having. The key is to be an active partner with your medical team, armed with the knowledge of what's possible now. Thanks so much for joining me for this explainer.